Hello, Dr. Oja. Can you hear me?
Start.
Can you hear me?
Yes.
Oja, we have a patient in the ICU. The patient had an acute MI and he went for a primary angioplasty. He was shifted to the ICU, but he again had a cardiac arrest. So we are trying to revive the patient. And I'm just trying to tell you that the CPR is already ongoing. Patient is already intubated and connected to a ventilator, and all pharmaceutical agents are going on. CPR is going on. The patient is in retake. I would like to shock the patient. Please shock the patient. So I just wanted to tell,
Jelly
ask.
applied, pad applied, eye clear, you clear, all clear, DC shock given.
Okay. Perhaps there is no response to DC shock now. At the moment, again the CPR continues. So I am just trying to, this is around 6 minutes of CPR going on and I find there has been no response. So I just would like to call you to consider the possibility of giving an ECMO CPR to the patient. So can you kindly come upstairs, please?
Yeah, I'll come now.
So the CPR goes on, the patient is on advanced CPR. The team number 1 who's looking after the airways, team number 2 is looking after the chest compression, and team number 3 and 4 are looking after the pharmacological agents. Team number 4 is a defibrillator man, the team number 5 is a secondary man who will continue with CPR. We are following the ACLS guidelines of 2 minute CPR cycle, and the CPR is going on. The patient is again in VTEC. I would just like to shock the patient again. Please shock the patient.
Jelly applied, pad applied, you clear, eye clear, all clear, DC shock given.
Okay. Still the diagonal rhythm, the VTEC phase is not reverted. It was a post-resuscitation ECR. I have asked the relatives have been on flow. It is now 7th minute of CPR going on. And I am waiting for Dr. Oja to reach here. And we have started the counseling a bit early, and I have primed the relatives a bit early because in India we take time to give the consent for finances. So therefore the CPR goes on and the patient we are trying to revive. Still there is a VFib going on, and this is the 4th DC shock being given, and CPR continues. 2 minutes of each cycle are over. Please give adrenaline. Please give cordron. Yes. Again give a DC shock. Yes, Dr. Oja,
Jelly applied, pad applied, eye clear, you clear, all clear, DC shock given.
Okay, now the patient is in torsade. Anyway, continue with the CPR. Give adrenaline, give cordron. Yes, continue with CPR. Please start with the IV fluids and send the blood sample for the analysis. Dr. Oja, this is the patient of acute MI. He underwent an angioplasty. He has come out in the ICU and again had a cardiac arrest. We are trying to revive the patient. Around 7th minute of CPR has already been over. We have intubated the patient and CPR goes on. Patient goes into a resistant VTEC. The relatives are here. Have tried to pre-counsel them. Now please carry on. This is now 8th minute of CPR going on. Okay. The relatives.
Call the relatives.
Yeah. Continue with CPR, please. Team number 1. You can.
आपके क्या लग रहा है ये?
सर मेरे फ्रेंड के पापा है सर.
हाँ.
मेरा फ्रेंड बाहर गांव गया है सर. फ़ोन पे मेरी बात हुई थी डॉक्टर गोयल से जब उनको चेस्ट पेन हो रहा था. तो मैंने बोला था तुरंत रिद्धिविनायक हॉस्पिटल जाइए बिकॉज आई हैड अ फेथ ऑन रिद्धिविनायक हॉस्पिटल. सो आई हैड सेंड अर्लीस्ट टू रिद्धिविनायक हॉस्पिटल. नाउ आफ्टर डूइंग एंजियोप्लास्टी मुझे मालूम था सर एंजियोप्लास्टी के बारे में, तो मैंने बोला प्लीज़ गो अहेड. अभी बोल रहे हैं कि बैड हो गया है और एक चीज़ मशीन डालने की ज़रूरत बोल रहे हैं. तो व्हाट इज़ दैट सर?
देखो क्या हुआ है कि उनको बड़ा हार्ट अटैक आए थे तभी भी कार्डियोजेनिक शॉक में थे. उनको इमीडिएटली एंजियोप्लास्टी के लिए लिया, एंजियोप्लास्टी किया, लेकिन जो हार्ट को डैमेज हो चुका है तो उसकी वजह से उनका हार्ट अभी काम करना बंद कर रहा है. उनकी दिल की धड़कन एकदम तेज हो जाती है, कभी कम बन जाती है. तो इसलिए उनको जो CPR करके हम लोग हार्ट को रिवाइव करने की कोशिश कर रहे हैं. ऑलमोस्ट अभी 8 से 10 मिनट हो गई है और हम लोग एक 8-10 मिनट ट्राई करेंगे. अगर उससे नहीं हुआ तो फिर अगर उनको आगे की जो ट्रीटमेंट है वो ECMO बोलते हैं वो डालना पड़ेगा, जिससे कि उनको हार्ट को थोड़ा आराम दे सके
9th minute
और
of
उसका
CPR
हार्ट
going
वापस
on.
चालू हो सके.
सर मेरा एक ही बोलना है, उसका लड़का नहीं है, डिसीजन मुझे लेना है और मेरे को डॉक्टर वेंकट गोयल के ऊपर फेथ है. मुझे डॉक्टर वेंकट गोयल से बात करनी है रिगार्डिंग फाइनेंसेस। अगर वो मेरी मदद करते हैं तो मैं आगे बढ़ूंगा, बिकॉज उसका लड़का ऑलरेडी उसके जस्ट थोड़े दिन पहले उसके फादर एक्सपायर हुए। सारा खर्चा उस हॉस्पिटल में किया गया है, तो बहुत खर्चे हो चुके हैं ऑलरेडी। इस पेशेंट में और खर्चे करने के लिए वो मेरे ऊपर आएगा, और मुझे डॉक्टर गोयल के ऊपर फेथ है। अगर डॉक्टर गोयल बोलते हैं कि मैं मदद करने के लिए तैयार हूँ, कहीं फंड वगैरह अगर आता है हॉस्पिटल से, कहीं होता है तो फंडिंग करिए, बिकॉज मेरे पास पैसे नहीं है। थोड़ा बहुत मैं लगा सकता हूँ, उसके लाइफ अगर बचनी है मैं लगा सकता हूँ, क्योंकि वो मेरा बेस्ट फ्रेंड है सर। तो अगर डॉक्टर गोयल मदद करने की कोशिश करते हॉस्पिटल के तरफ से, मुझे उनके मुंह से सुनना है। अगर वो मदद करने के लिए यस करते हैं तो मैं आगे बढ़ना चाहूँगा सर।
देखो अभी क्या है, टाइम बहुत क्रिटिकल है और हम डेफिनेटली पेशेंट की मदद करेंगे। थोड़ा आपको भी समझना रहेगा, थोड़ा हम भी
डॉक्टर साहब मुझे आपके ऊपर फेथ है, प्लीज़। मैंने इससे पहले भी मैंने आपके पास ही भेजे हैं सब पेशेंट, आपने मदद की है। ये पेशेंट में भी आप प्लीज़ मदद करेंगे तो आगे बढ़िए सर।
तो हम मदद करेंगे।
प्लीज़ प्लीज़ डॉक्टर साहब मुझे प्लीज़ पेशेंट को बचाइए सर।
टाइम
आप करिए, आप मदद करेंगे फाइनेंशियली सर?
हाँ मदद करेंगे फाइनेंशियली।
प्लीज गो अहेड, प्लीज गो अहेड।
टाइम बहुत क्रूशियल है,
थैंक यू
टाइम पे
सर।
करने का।
ठीक है।
ओके डॉक्टर ओझा, इट्स नाउ अराउंड 10 minutes of CPR going on and the counseling has been done, the relatives are given a consent and final details will look into detail afterwards. Please continue with the CPR, ECPR.
Okay, fine. So call the surgeon for a backup. Okay, fine.
Pupils not reacting.
Okay. The ETC2 has been around 12 to 14. It's remaining the same. It has not improved. The compression pressures are generating an arterial pressure of around 40. The patient is in a junction rhythm or a EMD, I would like to say. There is no BP response. CPR continues, but the VTAC has come down and the ECMO team has been activated. So the ECMO team consists of two major components. One is priming the circuit and the second is cannulation. So the priming circuit team, the technicians and the perfusionist team are on the job. They have scrubbed and now they are preparing the circuit. So the time has started. Now this is the 11th minute of CPR going on, and ECMO team has been activated since 1 minute, and we are trying to see how fast they cannulate. Meanwhile, Dr. Oja has gone for preparing the cannulation, scrubbing himself for preparing the cannulation. So both there are around 8-member team on the ECPR team. The 12th minute of CPR is going on, and there are 8 members in the CPR team. So total around 16 to 20 people are there to help the patient out. In the CPR team, there is team number 1 looking after the airways, team number 2 and 3 looking after the CPR, team number 4 is looking after the defibrillation, 5 and 6 are looking after the pharmacological agent therapy. We are waiting for the blood reports, and the cannulator number 1 and 2 have already arrived. They are preparing the table for cannulation, and the draping team, the priming team is already on the job for starting the priming. The whole aim is to do the things in as fast as possible in the minimal possible time. So CPR continues. We are now of the 12th minute of CPR going on, and we would like to see how fast they can cannulate. So most
please can you move this out?
Pupils are not reacting.
Okay. Okay, we are again a VTAC going on, please. Be ready for DC shock. DC shock, please.
Please open this area.
Jelly applied, pad applied, eye clear, U clear, all clear, DC shock given.
Make it slightly lower.
Thank you very much. DC shock, again the rhythm that returns to a junctional rhythm, and BP has slightly increased to 46.
Okay.
The ET2 coming up to 16.
Sister,
And
draw
with the
seat,
junction
please.
rhythm going on, and we are in the 13th minute of CPR going on. So team member are just preparing themselves for the CPR. I would feel the painting and other
Painting has been started, sir.
yes.
Pupils not reacting.
Okay. Okay, the pressure has come to around 50 systolic.
Give me a betadine, please.
Intermittent, the ETC2 comes up to 18, 19, and then goes back to 14, 15. And
So fast.
saturations are not seen, the oxygen saturations. Meantime, the scrubbing part is over,
Hello, give
and
me a
they are getting
Fast,
ready for
fast, rapid.
cannulating the patient. There you can see Mr. Ashok, the perfusionist is priming the circuit,
वेंटी कनेक्ट कर दो
and we are now into the
Kapil, surgical team has been informed.
yes, sir. Has been informed the surgical team.
we are now into the 14th minute of CPR and the 4th minute of ECPR. In 4 minutes time, the draping part is getting over, and the circuit priming is continuing. The patient continues to be in a junction rhythm with a heart rate of around 20-27 and a BP of around 50 systolic with an ETCO2 of around 17, and an alternate cycle of CPR continues.
Sister,
The
give
blood
me a
cell
guide wire, please.
Give me 2 wires fast.
2 minutes advanced CPR cycle of ACLS is being followed, and the patient has been given boluses of adrenaline and cortisone. With that, the patient has a BP of around 46, but not really. It is basically a conducted beats. I still feel the patient is in EMD, and they have taken the puncture. If you look at the cannulation team, the venous puncture has been taken, and the priming team is there on the right hand side.
Wire, yes, wire is going smoothly.
कितना minutes हुआ?
Okay, the first wire is in place. The priming team is on the job of priming the
First
circuit.
the line and give me. First the need and give me.
CPR continues.
Give me another wire.
Yes, another wire
Pupils
is
reacting,
ready.
sir.
This is the
First it and give it to me.
Pupils
okay.
reacting.
Pupils have been starting to react. The
Please be ready with the heparin bolus.
to start inotrope, sister.
Second puncture has been done, sir.
Now this is about to go land up into the 16th minute of ECPR, CPR and the 6th minute of ECPR. So with that, you can find a slight improvement in the heart rate of the patient, and BP remains the same. The second puncture has already also been taking place, and the priming circuit is
Chalo, fast. Give me dilator, blade.
about
Fast.
to get completed.
Please give the bolus heparin.
Both the wires are in place.
First we'll do venous. First we'll do venous.
First venous. Okay.
So there are two cannulators, one on the right and one on the left, which are assisting in cannulating the patient, and the priming team is taking the job separately.
First dilator is in there. 6 French dilators.
CPR continues. There is a junction rhythm with a heart rate of around 60 to 80.
Sir, VF.
Again the patient goes into VF. Please be ready to shock the patient. Everybody will be on guard. Everybody be on guard.
Do not
Again.
soak. Do not soak now.
Wait a minute. Just
wait.
hold the line.
Please be ready with the cannula, sister.
Just continue massage.
Pupils reacting.
Give me a venous cannula. Yes.
Okay, can we shock in between, sir?
No, just a minute. Just a minute. Let me finish it. Continue with the massage fast.
Okay, the pulse is, the BP is 0. The patient is in a VTAC rhythm. Okay, the venous cannula is in place.
Yeah, be ready with shock.
Be ready with shock, please.
Yes. Now you can
Yes.
shock him.
Yes. Just
Leave it,
please
leave it,
stay-
leave it, leave it, leave the
jelly
wire,
applied
leave the
pad
wire.
applied I clear you clear all clear DC shock given
Okay.
Okay. Again,
Get the clamp.
junction rhythm, and now this is the 8th minute of ECPR and the 18th minute of CPR going on. The venous cannula is in place. The arterial cannula is about to be over. Mr. Ashok, how much time will you take? The priming is ready. So they have done a fantastic job. In around 8 minutes time, they have primed the circuit. And another in the same time,
Get the circuit on
the-
cable.
get the circuit towards the patient. So in 8 minutes time, they are ready to put the patient on ECMO. The venous line is, venous cannula is inside, the arterial cannula is about to go inside.
We are doing dilatations of the arterial cannula, sir.
Right. Now the patient tends to return to us towards the sinus rhythm of around 70 beats per minute, and a BP, please check the BP. The saturation is not palpable. The ETCO2 has come up to around 18 to 20.
Pupils reacting.
Okay, very good. You can see some hand movements also there.
Yeah, hand movement is also there, sir.
Meantime, Mr. Ashok,
So both the cannulations has been done.
get your assistant for the hypothermia, please. Be okay. This is the 19th minute of CPR and the 9th minute of ECPR.
Claim please.
There is hand movement.
Okay. So cross clamping has been done.
Increase RPM to 2000. This is venous.
The ET2 is tending to rise to reaching around 20.
Pupils reacting.
Right.
There is hand movement also.
So connections has been done, venous as well as arterial.
Increase RPM to 2000. Fast.
So the ECMO is on flow in our 10 minutes job from 10th minute.
Venous arterial clamp was opened first, RPM has been increased, and lastly we had removed the arterial clamp.
Increase the flow to 3 to 3.5 bars. That's right. Yeah, that's it.
Please,
Stop CPR. Stop CPR.
please add a hypothermic
Don't
setup.
start heater unit. Don't start heater unit.
Don't start, please don't start intercooler unit.
Okay.
Map is coming up.
Yeah, the map is coming up. The ET suit has come to 24. There's a sinus rhythm. The BP has come up to 80 systolic, SPO to around 73. So the parameters are tending to settle down, and the CPR has been stopped, and there was some amount of hypokalemia which is already been put to correction. Sugar were also low. That is also being corrected, and the patient appears to getting stabilized, and the ECMO is on flow. So at 10th minute of ECMO activation and 20th minute of CPR, we were in business. The ECMO has been applied very beautifully. The circuit and the cannulation both were completed by 8th minute. Another 2 minutes for application of the ECMO circuit to the patient, and ECMO on flow in 10 minutes time. So in 20 minutes of CPR procedure and 2 minutes of counseling, a relatively early counseling, just to reduce the time of application of ECPR, and 10th minute they started the ECPR program, and 20th minute everything was in place, and they have been everything has been cannulated properly. You can see the circuit now. The circuit is on flow. The patient has been cannulated properly. It's a VA ECMO, and we are at around 3.5 liters with a mean arterial pressure of around 93, pulse of 100, saturation of 85, ET2 of 28, and a pulmonary artery pressure of around 17. So this is how, this was an exercise to show you to apply ECMO in CPR at a proper time and with proper skill and at as fast as possible. So this has been done. We will take the patient.
Plan is we'll put a disturb oxygen cannula after we take him to NGO.
Yes.
We'll take him to cath lab.
We'll take the patient to cath lab again. We'll see the coronaries again, and in meantime we are coming for debriefing downstairs.
Before shifting the patient, sister, please check the ACT, collect the samples for CBC, PT, APTT fibrinogens and RFT, and start the heparin infusion. Just let me know the ACT level.